Thank you, Tamir. Thank you for the introduction. Welcome, everyone, and thank you to all the healthcarepreneurs in the room today. I want to ask for an applause. I think there was a big effort to prepare this vertical. Thank you to all our partners. We have EAT Health with us. We have a lot of startups. We also have healthcare professionals with us today who came here to share their ideas, their challenges, and we are overwhelmed with all the interactions that we already have and with all the projects that are going to be seeded and raised from the interactions today. So in this healthcare vertical, and Tamir was asking me to open a bit the discussion by introducing what we are going to be covering along the day with AstraZeneca, with our partners, with our ecosystem. We're going to cover the finance gap. We're going to cover this challenge that startups, big corporates, and the public administration sometimes face when they are trying to start innovation projects, when they're trying to adopt digital innovation. We're going to also talk about the skill gap. I think that's a gap that everybody have experienced over the last years. World is evolving super fast, and there are things that we just don't know how to deal with. And this skill gap, how to learn more about AI, learn more about many apps that are coming, many platforms, many therapeutical areas that are raising many diseases and diagnostic challenges that we have in the healthcare community that we need to learn more about and that we need to be trained for. Then, after talking about the skill gap, we're going to also be talking about how the regulatory gap, the access gap from the population to digital health is also being addressed in some of the surrounding countries, in some other geographies, and also in Spain, and how the healthcarepreneurs need to pave the road for the healthcare systems in order to adopt faster digital healthcare innovation. Also, we will be talking in other forums with our human resources vice president from AstraZeneca in Spain about the challenges that we have to bring the human aspect and talent to the healthcare arena. You know that AstraZeneca is making a big investment both in digital healthcare, also in innovation, and with a great hub with more than 1,000 people will be working by 2025 in our R&D hub in Barcelona. We already have more than 200 working there from the end-to-end of the R&D, including AI, digital healthcare innovation, big data in our processes in order to fasten the gap from research to clinical medicine. And we will be talking also about this talent gap and how we attract the best of the talents in our ecosystem. So, Tamir, with all this vertical, how big companies, biomedical companies, how startups are collaborating. I think you're the cornerstone of our collaborations with Cordio. We have a great project in hands, and we have also a great discussion. How do you feel today? What do you want to share with the audience?
All right, so I really thought that I'm going to follow on your introduction and talk a little bit first about the gaps that you mentioned, which I think are crucial. And I think that no startup is like a healthcare startup. So, and no healthcare startup is like a digital health startup. So first of all, what we're doing in Cordio, we're developing a system that actually allow remote monitoring of patient speech, looking at heart failure patients and alerting before they're hospitalized. So what we're actually doing is software as medical device, right? Software as medical device, which means it's not just the software. So if from day one, and this is the first gap that I want to talk about, the clinical one, you don't have a healthcare practitioner, preferably a physician, that knows really well what you do. Doesn't matter if you have Bill Gates as your, sort of Bill Gates as your CTO, you're still not going to have a product that will go into the market. So from day one, design with a healthcare practitioner.
So you can be calm today because we have physicians in the room, Tamir. So I think we can get something out of this discussion.
100%.
When you're facing this regulatory gap, and I think that I feel that there is a, in your comment, there is a lot of strength. Like, it's not just a software, it's a medical device.
100%.
What are the gaps that you're facing in your, daily talent when you kind of wake up in the morning and you say to yourself, it's not just a software, it's a medical device? What is this regulatory gap that you're facing?
So it's not just regulatory. First, it's human resources.
Okay.
Because from one side, you got software engineers, they're being taught they can do everything. Everything is one and zeros. You work hard enough, you'll do it. From the other side, you have physicians. Physicians can do anything. They're regulated, they're driven heavily by their profession. This is a big clash between the two. So when you tell a software engineer, hey, we need to do a clinical study to validate the product, he looks at you, but it's working. Doesn't need a clinical study on 100,000 people, so this is the first big obstacle. Mm-hmm. The second big obstacle that you have, and I think it's crucial from regulatory side, is that this thing is regulated, right? It's not like you're developing a wellness app and everybody can do everything with it. You need to go to regulatory authorities. It's a problem. And again, you need to drive that hard into your software engineers. They don't understand it. They don't used to it. And third, and most importantly, this is, I think, my biggest advice to whoever thinking about a startup in this field: who's going to pay for your product? If you're developing a medical device, who's going to pay for it? Who's going to cover it? There's a difference between the two. And in what geographies you're going to work. It's different in the US, it's different in Europe. In Europe inside, it's different. It's different in Australia. Those are big questions that doesn't allow you to sleep well.
So we have a huge challenge ahead. We will be trying to solve that through the conversations on the vertical in healthcare. But let's deep inside a bit on the how to collaborate when you're developing engineers, also physicians, healthcare professionals, nurses. How many people in the room, please raise your hand if you've been working hand by hand with engineers and medical doctors or nurses in the last 2-3 years? Raise your hand to see if we have enough critical mass. So it seems that it's more frequent that engineers, medical doctors, nurses start to work together. And I wanted to ask you about this interaction and how you co-create, which is the methodology that you use in order to identify the gap that is like a real gap in the healthcare system, either if it's a diagnostic one, an adherence one, like in order to accelerate this patient pathway and to bring those patients into diagnosis and treatment faster. How do you identify those gaps with healthcare professionals, and how do you make your engineers understand the gap in order to design something that can really cover it?
So I think that I can give the hero story, which is what the platform we developed. So the entire idea started by a physician. Like a physician came, everybody's looking for a remote monitoring of heart failure. It's like the holy grail of remote monitoring. And one of the physicians, it's a big physician, a big cardiologist in Israel, a very known one, he said, well, when my patient calls me over the phone, I can hear in their speech that they're congested when he knows them already. But when I hear it, it's too late. Let's think about a way that we can do it sooner. So first of all, the need itself came from a physician, right? Everybody knows that we need remote monitoring in heart failure. He identified the speech, and then it was sort of my job from the investor side to bring the right team and build people that can actually feel the need of the physician.
Yeah.
But then you have a lot of tension there still.
And Tamir, you know something, as a physician working in a hospital, I've experienced that. You see a huge difference when a team comes in order to help you to develop a solution. I think there are two kinds of teams. One of them is able to understand really in depth what you're trying to tell them. And physicians, we are a bit weird with our problems and challenges, and we don't want to share them with people that we think are not going to be able to completely cover the need, or that are going to come and go, or that are just there, to show up. So then there is this kind of challenge, I guess, when you're building this kind of team. How can you find people who are good developers, good business people, good regulators, who know the environment out of the hospital, but also have the empathy to understand the caveats, the challenges that a medical doctor faces. Sometimes, from out of the hospital, out of the primary healthcare, it's easy to say they don't do it because they don't want to. They are not digitalized enough because they don't want to. They don't adopt technology because they are not technological. But then when you leave the hospital, you open your phone and you're addicted to the same platforms, Netflix, Google Maps, we use Uber. Like doctors are more normal than we all think. And they are more digital than we all think, and they want to digitalize the healthcare system, but there 100%. Are so many barriers. So how do you build a team that has the empathy to understand that world and to embed in the healthcare arena?
So first of all, as a CEO, you need to be aware of what you just said. And this is a big lesson I learned like 15 to 17 years ago. When I started work for Hero, the second person I recruited, I didn't found the company. I joined like 2.5 years after he came out of an incubator. I was recruiting Dr. Ronit Chaviv, and she's like my left hand. My right hand is my CTO. It's Professor Ilan Shalom. He's the one developing all the ideas and everything. I'm just working for these guys. And she's a clinical person. She actually came from a pharma company.
Okay.
She worked for a company when I courted her called Actelion. And she's really, really the empathy, that everything that drives our relationship with physician. And she came from the R&D side in the pharma company, but still she got the qualities that you mentioned. She's empathy, she knows how to work around them. She built her team, so I let her build her team in a way that she can, sometimes we interview together someone, I said, no, I'm not sure she's gonna work hard enough. She said, maybe she will not work hard enough, but all the physician will talk to her, right?
That's true.
It's important. And she's got good empathy with the nurses.
So Tommy, I also think it's needed to have like more healthcare professionals and physicians in the pharma companies. How is your
100%.
relationship with the pharma? How is your relationship with AstraZeneca? What are we supporting you? What do you need from us? How is this ecosystem we are creating, and which value do you find on it?
So we talked about gaps, right? So one of the biggest gaps that AstraZeneca helped us with is market access and understanding. Not just for Spain, but in general. So the ability of a small company such as ours to lean on our resources, and it's not just money. Seriously, the last thing that in our relationship, it's not that we're not seeing indirect funding from you supporting the pilot in Spain, but really your ability to open doors for us, to explain to us, and it's happened, how to approach the hospital, to debrief before any meeting that we're doing with them. This has opened us a lot of doors, and you actually and brought us into the best cardiology department in Spain. Yeah. This is closing a gap that alone we couldn't do.
I would say understanding the healthcare system. In fact, I joined biomedical companies 3 years ago, coming from the public sector. When they talked to me about market access, I was like, what market? Like, what is market access? And you know what? When you work in the healthcare sector, you would never define the healthcare sector as a market, because a market is usually ruled by concrete norms. There is a, proper CEO that you can go to talk to when you have a client. Have you ever met the CEO of a healthcare ecosystem? Not of a healthcare system, but of a healthcare ecosystem. Who owns the healthcare ecosystem? When you try to knock the door of a healthcare ecosystem in order to make digital healthcare happen, you need to talk to so many stakeholders. Of course, the CEO of the hospital is important. Of course, the public administration ruler or governor is super important. But you also have patient associations. You have physicians associations. You also have the day-to-day work and how this hospital works. And there are so many norms, so many rules. And for that, I think having an ally, I would say the most important ally in order to do this healthcare ecosystem access, beyond market access, are patients. So how many patients do we have in the room today? Or how many of us are going to be patients in the future? Can you raise your hand? Okay, then. So we are talking about how we produce and how we create solutions for patients, and we are the clients of the present or the clients of the future. So when you think about that and you think about the solution that we are developing together, when we explain it to people here in the market, in the healthcare ecosystem, they are like, what? Like with one single, with a voice, you can predict if somebody's gonna have like heart failure event, and then you can really do an intervention, put them on treatment. How can you do that? How can patients deal with that? How do you prepare yourself? How do you prepare your project in order to engage with patients and make them really be proper users and enjoy your product?
So first of all, I want to comment on two things. First of all, about access to I want to straighten your point even more.
Okay.
When you go talk to physicians, they're not investors. a cool presentation, a quick pitch, being very eloquent in what you're saying will not help you. You need to have a physician on your side, someone from your clinical advisory board, someone that is doing your studies. He's the one that you speak without a physician. And you drive the message not by sleek presentation, but by sending this physician to a professional convention and publishing peer-reviewed articles. And as for the patient, if you're developing a monitoring solution, even if it's just by speech, the most important thing is compliance. If you don't do usability all the time, around the clock with the patient, you will never, ever succeed. One of the big milestones that we worked with AstraZeneca and this pilot here, that the first stage is usability. We want to find out that not just the patient, but the clinic is happy with the device and everything is working. For what I hear, it's working not bad, right?
It's not working bad, and of course, I think in every project we design, we try to include this magic triangle, as we call it, which is composed by the healthcare professional, of course the patient, and also the healthcare system itself, the regulators, the managers. So it's kind of difficult to go through the path of making digital healthcare available and real, but we are decided to go through this pathway as a biomedical company, as an ecosystem. And you know why? Because, I mean, in a company like AstraZeneca, where we do investments on R&D every year beyond 10,000 million euros, like when you're really investing in R&D, when you're trying to bring the best of the innovations to people, you really need to take care that this innovation really gets to people. And we have so many therapeutical areas with specific conditions that take more than 3 to 5 years in order to be diagnosed, with people that are really suffering those conditions, not being able to be diagnosed. And then we see how this ecosystem, how startups can help us diagnose faster, get faster from the primary healthcare to the hospital services, get faster through the diagnostics, or even improve diagnostics. I mean, I think there is a huge gap in order to make this innovation get to our population. Some people start talking about population health, like how to get to this, big population that is in need of our innovation. And Tamir, this is a surprise question that I wanted to make about population health, how to get to bigger number of people, population health, how to really improve clinical outcomes and how to make people live better. What is the challenge in order to scale up those solutions, in order to make governments realize that we need to get to these people in need, and how to make those innovations get to this, I would say, the population healthcare gap or population health gap? What is your tip to the audience on that?
So I think what we do is really important for us opening the market, and I think it's as important almost as getting money from a VC. This is how important it is for us in our company. And secondly, I will go to digital health. You got a system and a product that you can distribute to every person, to every phone. You can just download it. The physician can contact remotely. You can get into any corner of the universe. Now with the satellites, with giving internet all over the place, and you're doing it bespoke. So our system is patient dependent. We're not looking at the universal. We're looking at the same patient, so it's more accurate. So it's easier, it's accurate, it's easy to distribute, and we're really, really lucky to have you as a partner pushing this solution into the market.
Thank you, Tamir. So as a conclusion from this panel, I would say we have a great innovation coming from our R&D. We have a great innovation coming from our startups, our ecosystem in digital healthcare. We need to go beyond healthcare because we know that patients are not covered enough. We need, as patients and future patients, to have better lives. If we combine both and we really can transform healthcare delivery through digital innovation, we will be able to create a better healthcare system, to transform the healthcare system into a health system that really is concentrated and focused on outcomes. Not only clinical outcomes, but life outcomes. And we will be talking about beyond healthcare, there is health, and beyond health, there is life. Thank you very much.